Good morning, I'm your host, Dr. Festus Osai. You're welcome to the Medical Ultrasound Forum. The Medical Ultrasound Forum is a group of professionals that are in the business of ultrasound scan. We teach ultrasound scan, we learn ultrasound scan. Of course, we use our skill to save lives and to promote the ultrasound knowledge in our country, Nigeria. So you're welcome. You can be part of us. If you want to be part of us, just let someone among the group recommend you, or someone we know recommend you, that we can add you to the group. So you too can contribute your quota in the development of ultrasound scan in Nigeria. Yes, we want to look at something that is very, very important. Talk about ways or guidelines to prevent issues of medical challenges in ultrasound scan. You know, there's an increased rate of medical challenges in the medical profession currently, and an ultrasound scan is not an exception. Anything can happen. You can write a report today, and tomorrow you'll see yourself in court. What are the things you need to know to prevent some certain these unforeseen challenges or problems? Or rather, if the patient takes you to court, what are the things you need to do, at least to safeguard your practice and also safeguard what you need to do? Well, we're going to go on and look at this. Talking about my book, before I forget. Remember, you can go to any of these contacts to get my book. This is the first edition of my book. And of course, this is the second edition of my book, Obstetric Ultrasonography, Basic Principles and Techniques. It's a 340-page medical ultrasound book, and it's very, very wonderful. A lot of people have collected the book across the country. I wonder what you're waiting for. Try and get a copy now. It will give you a lot of things, well illustrations that will make things better for you as you're scanning. Now, this was a case I shared in the forum not long ago, and lots of reports, lot of issues, people talk, made their comments and the rest. Yes, we have to guide our practice as much as we can. I know more people are becoming more and more aware. It can happen to us in Nigeria. Maybe we've not heard about it. This was a case that happened all the way in India, where a very renowned medical practitioner, a doctor, renowned medical practitioner, did a scan in a patient. And of course, he wrote there was normal findings. And at delivery, they discovered the baby had no hands and legs. The parents had to take this man to court, the facility to court, and they won the case. So these things can happen to any of us. It can happen to you. It can happen to you that's watching me right now. This is a radiologist. It's very highly placed medical consultant. A radiologist. It can happen to you. It can happen to anybody, even me and others. So what I want to tell is, what are the things we need to do to guide us against falling in such victims of such situations at a point in time? So I'm going to give the guideline one after the other. Nobody's immune to mistake. We can make mistake, but let the mistake not be a costly one at any point in time. Now, I want to tell you the guidelines. I'm going to give you 20 guidelines. If you can follow at least majority of these guidelines, you may likely fall into such challenges as well. Now, the first thing I will talk about is cross-check, number one, the biodata of the patient, and make sure it corresponds to the exact patient that owns the result before signing and sending the report. Sometimes when we're overwhelmed with activity, the name of the patient is different, the report is different. You can't say if somebody is pregnant and it's not pregnant and send the result outside. And after some time, the patient comes and says, this is the result you gave to me. And of course, you must have signed that report. So it becomes a challenge. Please take note, it's very, very important. You know, some of us, we conduct the scan, but someone else typed the report for us and they bring the result to sign. You don't even go through the report, you just sign the report. Be very, very careful. And that takes us to number two. Read thoroughly through the reports before you sign it as well. Then make sure the details of the ultrasound printout, in other words, the thermal paper, correspond to the patient's own report. Sometimes you must scan like 5 patients and you saved one of the patient's information right there in the machine. And while you are scanning others, you didn't bother to delete the former patient's report. So what happens is this: in the thermal paper that you're printing out or the printout, the patient that you've not deleted the information previously may likely be the name that will appear in the current printout you are sending out. And of course, that can be a problem. And maybe you did some certain parameters on the patient on the previous scan and you didn't delete the patient's information. You scan the next patient and you do a printout. That can give problems at the way. So be very, very careful with that. Then please use simple, easy, understandable, but appropriate terminologies while scanning the report. Okay, there should be an E here. Okay, when scanning the report, don't use big medical jargons. Simple terminologies, so that even the patient and somebody will understand that. Look, okay, this one even. Before it gets to that level that they need to start calling to make some level of interpretation, of course, it might have saved you a lot. Use simple terminologies. Like somebody did a scan one time and said the woman had the flatus in ultrasound scan. What do you mean by flatus in ultrasound scan? In fact, people do a lot of things that are quite amazing. Okay, now avoid using absolute terms and words, bearing in mind the possible limitations of the ultrasound scan itself. This is a very, very vital point. Very, very vital point I want us to look at. Okay? We need to, don't just, for example, do not say no. See, no is under is taken because it's very important. No fetal abnormality seen, but rather say no obvious fetal abnormality seen. Yes, although this one, the baby was born without arms and legs, in case I just showed you now. Of course, the doctor now pick it out, and that's why we took him to court. Those features you can see in scan anyway, but there's some certain abnormalities that you may not pick in scan. So don't just say no fetal abnormality seen, no obvious. In other words, at that point in time, there are forms of limitations that you may not see such abnormalities when they are present in scan. And that may help you when it comes to medical legal issues. Then, in the gestational age of the fetus, always include possible error margins. 1 to 3 weeks. I'm talking about 1 to 2 weeks. Yes. So that if someone comes and says, the doctor said I gave birth and so time, and I'm supposed to give birth. No, and make sure you tell the patient too, you counsel them that LMP is of much accurate figure for in terms of gestational age to give gestational age than ultrasound scan. They should know that. So you do some form of counseling as you scan them as well. Then also put your error margin. Don't tell them, man, this is the absolute age of the baby. No, there's no absolute age. That's why it's called an estimated gestational age of the fetus. Then in the weight estimation of the fetus, please take notes. Also put the error margin. Somebody might sue you to court, say, look, you did a scan and said my baby was 3.5 kg, and the baby came out to be 3.2. So, and mind you, there are error margins, machine error, human error, and the rest can make the weight not be exact weight to get. Like some of my patients, when they come and tell me that, look, doc, it was the actual exact weight you told me I delivered. I say, well, it doesn't really follow. I don't take the credit. I tell them that there's usually error margin. If it falls within that time, good luck for you. But usually there's an error margin. So create the room for error margin. Okay? 0.3 kg to 4 kg, 3.4 kg. So if a baby was someone you estimated 3.2 kg as of today, and the baby was delivered the next day, and the baby came out to be 3.0 kg, it is still within the normal limits, and nobody will take you for medical legal issues. Okay, now make sure that the patients, you have the training and expertise in the scanning you are conducting. If you've not gone through any form of training, or you don't have the expertise in ultrasound scan, I don't know what you have no business being in ultrasound scan. That can be a very big challenge to you. So you must have gotten some training in that, especially in that area you're looking at. If you're not good in obstetric scan, people just buy the machine and start scanning. Someone has to put you through. Ultrasound scan is both academic and apprenticeship acquired. So even as much as someone is teaching, you are buying the machine. Even if you read the books, even if you get the degrees, the masters and PhD, whatever, you still need to go through the apprenticeship period of ultrasound scan so that your skill can be commensurate with the degree you have. It's important, okay? Now, apply the best possible navigational techniques while scanning at all times. For example, in obstetrics, there's what we call fetal tracing. If that doctor had done a fetal tracing, of course, he wouldn't have missed out that congenital abnormality. Fetal tracing, I did a training on that not long ago. Very, very important. Fetal tracing obstetrics is the key to prevent the missing out abnormalities in the fetus while you're scanning. Okay? The gender assessment, please, you must take the consent of the patient first. And as you've done that, okay, you've done that then before you inform the patient. Don't just say, madam, you're having a male or female. Please, some may sue you. They say they don't want to know. So please inform the patient first, take their permission before you tell them. Then, of course, you're checking the gender, but you have to be absolutely sure that you are actually sure of the genitals of the baby before you tell the parents. Please, because someone can sue you for this. You told me it's a male child, it came out to be female. Why? I don't believe in eyes of faith. Gender is as simple as you look at the genitals. If it's male, it's male. If female, it's female. That's how I see it. And a lot of people have gone through my training too that follow consistently. That as of now, I don't think they've missed the gender of the fetus. So you need to do that. If you are not sure, don't say. Just leave it at that. Just tell them the baby is covering the legs and the rest. Okay? Use the appropriate parameters for the estimation of fetal age. Yes. Femoral length for femoral length, BPD for BPD. And that's what we talk about the rule of 6 in estimating fetal gestational age. Someone will come and do a scan at 34 weeks. The baby is 34 weeks pregnant. There's a certain parameter you use. The age will tell you the baby is already 40 weeks. And of course, you go and deliver a preterm baby. So please be careful with the kind of parameter you use at that point in time. Then always state the type of scan requested for. If a doctor sent a report to you and said, I want to do a routine scan, mind the routine scan is not a scan, it's not a fetal anomaly scan. So if you are doing a routine scan and you miss out some certain abnormalities, you should not be blamed as well. Because the routine scan, the cost for routine scan and cost for fetal anomaly scan, they are different. And of course, fetal anomaly scan has specific age of such scan is conducted. So it's important to do that, okay? Then state the time of scanning. What are your findings? If today I scan a patient and I see that it's breech presentation, and I write breech, and the moment delivers tomorrow and say it's cephalic, am I guilty? I'm not guilty. Because the baby could have turned. So at that point in time, you did a scan define these matters. Then generally in ultrasound scan, do create a room for possible limitations. Ultrasound scan is not absolute, it's not perfect. There are limitations, machine limitations, and handling limitations. And you know that ultrasound scan is highly what operator dependent, okay? Now, if you're scanning, always put level of what? Uncertainty. 1 query, 2 query, 3 query, depending on the level of uncertainty of your diagnosis. And of course, you know that most often times you have to send for histology to confirm your, especially when you're doing other form of scans. Okay, you need to send for histology to confirm your diagnosis. So avoid using absolute diagnosis or whatever. Just sometimes put a query there. So query means that you need to explore other means to achieve your final diagnosis. Then you request for auxiliary investigation, like laboratory investigation. So as I'm telling ultrasound scan you need to report for laboratory tests. Okay, a patient comes in and, for example, say she's bleeding now. She comes in and she's bleeding. So what's the case may be? And you're suspecting that could I be pregnancy or so. If first you do a PT and confirm the diagnosis, especially when you have a case of retained product of conception, it may likely be a woman is having hematometrum. So if there's this conflict of whatever, just do a PT and that confirms it and makes it better. So that you don't go and start sending the doctor to evacuate hematometrum, a menstrual blood, rather a PT test. Okay. Now talk about sometimes we request for other radiological investigations like CT scan, MRI. Yes, ultrasound scan is not absolute. Mistakes can come in at a point in time. Then please, there's always a room for follow-up scan. For example, if you want to localize placenta, you need to have a follow-up scan for you to finally confirm actually it's a low-lying placenta or actually the placenta previa, as case may be. Use of illustrative ultrasonography is necessary. Yes, look at this now. A patient will not understand what you are saying here. But when you draw a diagram and you explain to the patient, they can understand it. Okay, this is my uterus. Okay, I get one big fibroid here and I get one here. Okay. Because the patient will understand you first before they think of taking any legal action against you. Are you getting it? Good. Although when it comes to court cases, they may need some interpretation. They need to call the specialist or so to interpret. But before it gets to that level, what can you do as well? Illustrate whatever you're seeing here. Now look at this one now. If I send this to a patient, even some professionals may not understand how to interpret the scan report. But if I tell them to send something like this, or rather a diagram like this, is self-explanatory. This is breach and this is breach presentation. So now, if this is the case, if I send this one to a lot of people now, they won't know how to interpret this report of a pregnant woman. But when I send this or send this, it's really understandable. So illustrative ultrasonography will really help you out to save you from medical legal challenges. There was a doctor that had this emergency in the midnight, one of his patients, antenatal patient. So they did a cesarean section, and after delivery, he left, went home, and he came back that morning. What happened? He saw JTF with gun and everything looking for him. Where's the doctor? Where's the doctor? What has happened? He said the young man said the doctor has stolen his second baby, that the wife delivered twins. The guy was shocked. Me twins? Imagine a patient can be your friend today, your enemy tomorrow. So what happened? So he said, okay, no problem, sir. Let's go. What he did, he went to his folder and brought out 3 different scan reports. And each of the scan reports, there were illustration of one baby, in 3 of them. Mind you, the head of the team, which is a police, one of these police officers, he doesn't know how to read ultrasound reports. But from the illustration, he said, Oga, oh, sorry, Oga, I don't know. Now, so the man talk, or say you're picking twins. You're picking twins, you constable, select you won't go sell one. Not knowing that when he went to the woman to ask the woman said she never said so. Probably, maybe the effect of what? Maybe ketamine or that thing that must have caused this hallucination and rest, and I believe there was twins. So, obstetric ultrasonography is key to preventing some certain challenges when it comes in time. Before it gets to that level, imagine if they had arrested the doctor, it will be on media that the doctor is selling babies. Of course, he will be free when they go to the court and the rest, but imagine the nasty thing that would have happened to himself, of course, and his business at that point in time. So, illustrative ultrasonography is the key that you need to follow up. Then what are the other few things you need to look at? Add disclaimer column to your reporting sheet. That's some certain things you don't, although some disclaimer forms makes your report so unreliable. If you write like so many disclaimer forms, your report will not be unreliable. Write the ones as you can. Of course, you seek the counsel of a lawyer, like I talk on this other column. Then, second opinion. Always send, if you have a challenge, always send for second opinion. And also for review. How do you send that? Through your WhatsApp, through your Zoom, your WhatsApp, other forms of social media. You can send a live video to us or to other people you want to send to. You can even send the pictures so that you can look at it. Like some doctors have been doing that. Like I was in Bayelsa, some doctors in Bayelsa have been sending me pictures. There was one that sent a picture of an ectopic pregnancy, and I told him, I said, send me the video, and I did that. I told him he was so excited about it. So that can be done, and this and make it easy for us. So if issues come up, you say, yes. Did you send for a second opinion? Yes, I sent for a second opinion. How? You describe it. Of course, the doctor will be aware, maybe based on documentation, that he or she reviewed such a case with you. And of course, that will be an easy access to coming out of the case. Now, of course, employ a lawyer when the need arises. Then finally, you need to go for regular updates. Updates. What you learned 10 years ago in Ultrasound scan is not what is in trend, is what is trending now. You have to learn the new updates in Ultrasound scan. And we've done this all over the country. My team have been all over the country. Last month, we're in Nasarawa States. We're going to be in Lagos in the month of August for what we call the Lagos Ultrasound Scan Training Workshop. It's going to be an update for those of you that have been scanning before, and of course, for the newcomers, it will be an eye-opener to see some secrets and in the skills of ultrasound scan. So hope to see you in Lagos. Come 23rd to 26th of August 2022. And it's going to be wonderful at National Power Training Institute of Nigeria, NAPTIN. And we're doing it in conjunction with the Association of Nigerian Private Medical Practitioners, Lagos State Branch. I want to thank Dr. Makinde and also this chairman, also thank Dr. Debo, the secretary, for their cooperation. We've been putting things together to make sure the cost is down so that people can afford it. And of course, we have sponsors this time around, a sponsor from GGWA and Mindrace. Their sponsorship have made the cost to come down. So take this opportunity and get this thing done as well. Get it done as well. Great time. Then if you want any kind of information, you want to know anything, you can contact me through any of these numbers. Well, thanks for listening and God bless.